Millions of Americans could be affected, and most people still have no idea what's coming. There's a massive deadline hurtling towards us that could completely change the cost of healthcare. Dr. Mehmet Oz has been laying out what he says is the Trump camp's strategy to handle it, and right now, we're going to break down exactly what that plan is, and what it means for you.
To really get what's at stake here, you have to start with this. This is from a family that's looking at their health insurance premiums potentially jumping by nearly 400%. And their situation? It's not unique. It is a terrifying preview of what millions could face when a critical healthcare subsidy deadline hits at the end of this year. So this isn't just some abstract policy debate. For a lot of people, it feels like life or death. And that leads us right to the central question. With so much on the line, everybody is asking, is there actually a concrete plan to deal with this? Or is this all just talk? Well, according to Dr. Oz, who says he's been privy to these conversations, there are some very specific and pretty radical ideas on the table.
So, what exactly is this crisis that's looming over everyone's head? It all boils down to a single date, December 31st. That is the day the enhanced Obamacare subsidies are set to expire. You know, the ones put in place back during the COVID era to make insurance more affordable.
When those subsidies expire, it creates what a lot of people are calling a premium cliff. For millions of families who depend on them, the cost of just staying insured could become completely impossible, almost overnight. This is the urgent, ticking clock problem that any new healthcare proposal has to solve. Now, according to Dr. Oz, this premium cliff is really just a symptom of a much, much bigger problem. He argues that there are some fundamental flaws that are just baked into the current system, and they have to be addressed first. He points to several key issues that he believes are making the whole thing inefficient and, well, unsustainable.
First, let's just get our heads around the scale we're talking about. Dr. Oz says there are 24 million people on these Obamacare exchanges. That is a huge chunk of the population, right at the center of this. But a key part of his argument focuses on a really surprising trend. A growing number of these folks aren't even using their insurance.
And this is a startling figure he brings up. I mean, historically, about 20% of people on the exchanges didn't use their insurance in a given year. He claims that number has now doubled to a staggering 40%. This points to a major inefficiency, and you have to ask the question, why are so many people paying for insurance they never ever use?
Well, this leads to what he identifies as a massive problem, potential fraud and waste. Dr. Oz claims that as many as 4.4 million people might have coverage they shouldn't, many of them unknowingly enrolled by brokers in both Medicaid and an Obamacare plan. To use his words, this is paralyzing the system.
So what's the proposed fix for this specific issue? It's a surprisingly simple idea, actually, a tiny monthly copay, maybe just $5. The logic here is that by requiring a small active payment, an opt-in, you'd confirm that the person actually wants the coverage. It would basically weed out all of these improper enrollments.
Okay, so after identifying all those problems, what are the actual solutions being proposed? Dr. Oz lays out a broader, multi-part strategy. We're not talking about one single tweak here. It's a combination of approaches that are really designed to fundamentally change how the whole system works.
He briefly touches on one tool that was used in the past, cost-sharing reductions, or CSRs. Basically, these were payments the government made directly to insurance companies to help them lower costs for consumers. He claims that just bringing these back could have saved a pretty significant amount on premiums.
But the real core of the strategy as he lays it out is built on these 4 pillars. First, you tackle the fraud and abuse we just talked about. Second, and this is the most radical change of all, you stop sending subsidy payments to insurance companies and instead send them directly to the people. Third, you use existing things like health savings accounts, HSAs, as the way to deliver that money. And fourth, you directly attack the high cost of healthcare itself, especially prescription drugs.
Let's really dig into that second point, because it represents the most radical departure from the system we have now. This idea of sending payments directly to citizens would completely change the flow of money and, at least in theory, the entire dynamic of the insurance market.
And this slide illustrates that shift perfectly. Over on the left, you see our current system. The government pays the insurer, and the insurer then offers you a plan. But on the right, you see the proposed system. The government gives that money directly to you, empowering you to be the customer and shop for whatever plan you want in the marketplace.
So, what's the philosophy behind all this? Well, the core argument is that by putting the purchasing power directly into the hands of consumers, you create genuine market forces. The theory is that insurance companies would then have to actually compete for your business by offering better plans at lower prices.
It would transform the exchange into a true marketplace.
Of course, a proposal this ambitious raises some huge questions about the long-term impact. According to Dr. Oz, the focus isn't just on solving the immediate crisis, but on trying to create a healthcare system that is truly sustainable for the future.
And this slide really sums up the ultimate objectives. As Dr. Oz explains it, the goal is to build something that can last for decades, not just another temporary patch. The strategy aims to lower the actual cost of care, using tools like most favored nation drug pricing to force prices down, instead of just subsidizing an already expensive system. And the ultimate hope? To finally put an end to the yearly political food fights over healthcare funding.
And that leaves us with the bottom line, the ultimate question. This proposal represents a fundamental rethinking of American health insurance. Is this a genuinely sustainable solution that could empower consumers and drive down costs for good? Or is it a massive gamble with totally unknown consequences for millions and millions of people? That's the debate that's going to define the future of healthcare.
The debate over these ideas is only going to get more intense as that December 31st deadline gets closer. To stay informed and really make sense of the policies that are shaping our world, make sure you subscribe for more explainers just like this one.